if I've given you this video, it's to work on increasing length of your pelvic floor. I may have given this to you for your lower back pain, pelvic pain. Refer to my email and my guidelines in regards to how frequent and how often to do these exercises. And as always, if anything doesn't feel right for you, you can either email me or stop until you see me next time. So I'll be talking about some principles of the pelvic floor as I go through this video. And if you have any questions, obviously let me know. So this is a quadruped rocking exercise. We're going to start in an all fours position, hands under shoulders, knees under hips. As your hands are on the ground, placing pressure equally through your hands. If you find any pain in your wrists, you can always make fists or even go down to your forearms if that's more comfortable to do so. Alternatively, you can also do this exercise as far up as on a chair. Sometimes that will feel a little better. So whatever position is right for you. I'm going to demonstrate an all fours position. So a reminder of how the pelvic floor works in terms of length and tension. When our pelvis is tucked underneath us, or in what's called posterior pelvic tilt, tailbone down, the pelvic floor muscles that run from our pubic bone to our coccyx or tailbone are shortened. So again, when our pelvis is underneath, our pelvic floor is shortened or tightened. When our tailbone is up, that's when the pelvic floor is lengthened or long. For this exercise, we're looking to lengthen the pelvic floor, so we want that tailbone to be up. Now, in terms of your knee position, I'm just going to turn forwards here. It might be easier to see. We can have our knees directly underneath our hips, or we can bring them apart. That's going to increase length of some of the pelvic floor muscles. Or we can have them in what's called internal rotation. Okay, so the bottom of the legs are facing outwards, knees are facing inwards. In terms of what position is right for you, look on your email or my guidelines. I tell people to usually start with either knees underneath or knees a little bit wide. The internal rotation position tends to be pretty aggressive, so only do this if I've let you know, okay? So, doing a couple cat-cows can help us connect to this area of our body. So breathing in, reverse Kegel, tailbone up, head up, exhale, inhale, tailbone up, exhale, finding neutral spine. Now, if it's comfortable to do so, you can really go into anterior pelvic tilt, but if it's uncomfortable, just be mindful to keep the tailbone up. Having a mirror beside you can be helpful to see when your pelvic floor starts to tighten, because it can be hard to feel. It's not like a bicep, it's hard to feel for us. So, we're going to bring that tailbone up a little bit, and we're going to do our reverse Kegel. So breathing in, and exhale. As you breathe in, thinking about lengthening the pelvic floor, please refer to your reverse Kegel handout for this information, okay? That'll be helpful. Or if I've sent you a reverse Kegel video, refer to that. As we breathe in, we're going to rock backwards. So bringing our bum towards our heels. Now I don't have a mirror, so hopefully I can feel when I start to lose room. I think I'm losing room about there. And then exhaling forward. So essentially we know we're at our end range when our pelvis starts to do this, okay? I don't want you to push past that region. You can hang out back at end range and kind of rock side to side and breathe in. You can go down on your forearms and breathe into this position. and thinking about lengthening the pelvic floor. You can also rock forwards or backwards, breathing in and out, really doing whatever's comfortable for you. In terms of how many of these to do, if I haven't indicated on email, usually you can do 5 to 15 rocks, okay? Or you can hold at end range for 5 to 15 breaths. This one is very safely done daily. If my pelvic floor feels tight, or if I have a lot of rectal pressure, I'll do this one often. I really do enjoy it. I find it quite relieving. And if you're unsure whether or not you're getting that nice reverse Kegel, just keep in mind, as I've probably said to you, that it takes time to connect to this area. As I said, it's not like a bicep where we can look at it and really visualize it while letting go. Our symptoms will guide whether or not we're effectively moving this area. So I hope you found this helpful. And if you have any questions, please feel free to email me.